Hi, my name is Andrew Tatarsky. I'm a clinical psychologist, and I've been working in the field for my entire career, specializing in working with people that struggle with drugs. And I'm here to present a work, an approach to working with people with risky and addictive behavior that I call integrative harm reduction psychotherapy. And this is an approach that I think can really enhance the treatment of people who are struggling with risky and addictive behavior across the entire spectrum. As I said, I've been working in the field for my entire career, and came into the into the field in the 80s, and was introduced to what was the only paradigm, the only way to work with people struggling with addiction. And while I think we helped a lot of people, I began to recognize early on that the majority of people that were coming to our programs were not getting helped. And when I began to look around at the broader field, I noticed that that seems to be the standard. You know, the majority of people that are struggling are not going to treatment, to specialty addiction treatment. The majority of them are not staying. And this problem still continues to this day, and I'll share some statistics. But we are probably all quite aware of the incredible overdose crisis that we've been living with for the last 20 years. So I began to wonder, how to understand this failure, the limitations of our ability to be helpful. And I came to believe that, the dominant ideas that we have in our helping professions are essentially wrong or overly limited. The idea of disease, and then closely related to that, there's ubiquitous stigma. And I began to wonder if, these dominant ideas were largely responsible for our failure. So in the late 80s, I started a small private practice. And since the dominant approach wasn't working very well, I began to break all the rules. That is, we mental health professionals were taught, I certainly was, and I think many of you were, at least some of, the more senior folks in the team, that, you can't treat active addicts, quote, active addicts, or people really struggling with active addiction in psychotherapy, right? They have to get sober first, and then we can treat them. But since that wasn't working very well, I began to accept actively using folks into my practice, and many of them did incredibly well. They engaged meaningfully in treatment. Many of them cut back or stopped their substance use. They worked on other issues. And so this now threw me into a real quandary. The dominant approach wasn't working very well. Breaking the rules was, how to understand that. So I had the good fortune to have a relationship with a guy named Dr. Alan Marlatt, addictive behaviors field. And he was one of the people that brought harm reduction to the US from Europe. And I called Alan up in 1994 and I said, I shared my quandary, and I said, sort of, how do I make sense of this? And Alan said, Andrew, you're doing harm reduction. That introduction to the harm reduction framework for me offered a whole other paradigm, a whole other way to think about how we can set up helping relationships. And that really set me on my journey of drawing out the therapeutic helping implications of the harm reduction model. And that's what evolved into what I call integrative harm reduction psychotherapy. So